Now, I want you to imagine your breast like it's a broccoli. Hi everyone, welcome to Lactation with Amy. If you're expecting a little one or just curious about breastfeeding, you've come to the right place. Today we're going to dive into the topic of antenatal hand expressing, a technique that can help prepare your body for breastfeeding and ensure you're ready when your baby arrives. Whether you've heard of it or are just starting to explore it, we'll break it down step by step so that you feel confident and informed. Let's get started. Now, the letdown reflex is the fundamental of how breastfeeding works. When your baby breastfeeds, your brain releases a hormone called oxytocin, also known as the love hormone, which can cause the smooth muscles in your breast to contract and push out the milk. This is why you'll notice milk being released when your baby feeds. Oxytocin isn't just released during labor, it is also triggered when you feel calm, relaxed, and loved. And on the other hand, feelings of stress, tension, and lack of confidence can inhibit milk production. I have a video that goes through 13 tips to promote the letdown. I think it will be helpful if you're experiencing any trouble with hand expressing. Now, when you first start to practice hand expressing, your main goal is to help your breasts and nipples adapt to breastfeeding. So whether or not you see any colostrum coming out is completely normal. And remember, a breastfeeding baby can remove colostrum way easier compared to us hand expressing. When we are hand expressing, we are always trying to mimic what a baby does when a baby breastfeeds to trigger your body to release the letdown reflex. So a breastfeeding baby doesn't just open the mouth and latch mouth to breast. Instead, they actually use their little hands and explore and look around before they latch onto the breast. So number one, we're going to need to do a gentle massage to mimic the natural actions of baby when they're breastfeeding. You can use circular motions or glide your hands along your breast, or just do whatever feels comfortable for you. There's also the dancing finger technique you can use. Number two, finger placements. You want your fingers to be opposite of each other. You want to be able to draw a straight line between where your fingers are and your nipple. In this example, you can see that although your fingers are in that typical C shape, your fingers are not opposite of each other. If you're expressing using this technique, it can affect how much milk you're able to express out. And where are we going to put our fingers? Option 1, you can simply place your fingers opposite of each other just outside your areola. Now, this is an areola, this is an areola, and this is also an areola. Everyone's breast can be so different. So for hand expressing to work better for you, I want to go through option 2, which is a little bit more time consuming, but once you figure it out, it will significantly benefit you. Now, I want you to imagine your breast like it's a broccoli. A lactating breast will have lobules and clusters, just like a broccoli. These mammary glands are where the colostrum is stored. Using your fingers to fill your breast along from the outside towards your nipple. You want to feel areas where it feels more squishy and areas where it feels less squishy, more like the smooth feeling of the stem of the broccoli. This is where your ducts are. Try to put your fingers in this area where it feels less globular. So there are the two techniques. Try both and see which one feels more comfortable for you. With your chosen finger placements, we're going to start the motion of expressing. Keep your fingers where they are and apply pressure into your chest wall. This is a motion in towards yourself and down into your chest wall. Keep the motion there and then squeeze your fingers together. Let's practice this. Fingers towards the chest wall, keep the pressure, then squeeze together. Fingers towards the chest wall, keep the pressure and squeeze together. Repeat this process 5 to 10 times. Make sure you don't hurt yourself in this process. The last thing we want is bruises on a lactating breast, and for you to have painful breasts before even breastfeeding your baby. If you're seeing drops of colostrum, that's amazing. Keep your fingers where they are and continue this rhythmic movement. You can try experimenting with different speeds and rhythm. For example, you can do a press, hold, collect, or you can do press, hold, and hold, press, hold, press and hold, and see if the droplet starts to get bigger and easier for you to collect. Once the drops start to slow down, you can then try your fingers in another position. Release your fingers, rotate around the clock, and place your fingers opposite of each other and repeat step 1 and 2. If you don't see anything, Please don't panic. It is so normal. Now let's try rotating around the clock and fully let go of your breast. Try in another angle, repeat that 3 to 5 times. If you don't get anything out, try your fingers in another angle. And do this for 5 to 10 minutes, taking a small pause whenever you feel tired or frustrated. That wraps up the skill of hand expressing. Feel free to try it out, try different things, experiment and explore your breast and the magical things it's made to do. How often should I hand express? You can express once or twice a day. If you're experiencing any contractions, you should stop or reduce the frequency of expressing. Of course, if you're 38 weeks now and would like to encourage labor, expressing up to 2 to 3 times a day can be helpful. Important tip is that do not exceed 10 to 15 minutes per expressing session. What gestation is it safe to start hand expressing? If you have a low-risk pregnancy without any complications, you can begin expressing around 36 weeks, but always consult with your healthcare team first. If you have gestational diabetes, expressed colostrum will definitely help with baby's transition into life on the outside. How do I store the milk? The milk you express before birth, called colostrum, can be collected using a clean syringe. You can store this in the fridge for up to 72 hours. If your baby will be born soon, or if you're not yet in labor, it's best to freeze the milk. In the freezer, it can be stored for 3 to 6 months. When it is time for labor, you can simply bring the frozen syringe to the hospital in a cooler bag. Final tips. Hand expressing is a skill, and like anything, it may take time for you to get comfortable. Please do not worry if you don't express anything out at first. And remember, a calm, relaxed environment is the key for triggering the letdown reflex. And if you're feeling stressed, it might be harder for you to express milk. Practice makes perfect. Don't rush and take your time. If you have a very eager partner who would love to be involved, get them to have a go if you feel comfortable. Thank you so much for watching. I hope this video gives you a clearer understanding of antenatal expressing and how you can start preparing for breastfeeding. If you found this information helpful, don't forget to like, share, and subscribe to stay updated with more tips and videos like this. If you have any questions or if you'd like to share your personal experience, please drop them in the comments below. I would love to hear from you. And remember, every breastfeeding journey is so unique, so take it one step at a time and be kind to yourself. You can do it. See you in the next video. Bye.